On the Vino handheld ultrasound, we're going to first go up and select a musculoskeletal preset, and we put some gel on the ultrasound transducer, and then we're going to go find the posterior tibial artery. So we're just going to look in behind the medial side of the ankle, and we can adjust the depth just to make it a bit easier to see. We'll use the auto optimize feature, and we select color flow to display where the blood flow is, and we can see the posterior tibial artery there and veins. And what we're going to do is just try and rotate the transducer 90 degrees so that we can get a long axis of that posterior tibial artery, which we have here. And we should also steer the color box in the direction of the artery. So once we have a good picture of the artery, we can optimize the color flow if we want to, so we can just swipe on one side of the screen to increase the scale, or the PRF, and then we can select the pulse wave, and once we have the pulse wave mode enabled, we can just bring the sampling box over the artery, and of course we can adjust the sample angle as well. So we want to take that sample angle to 60 degrees, and we can just use the slider on the left hand side of the screen here to do that. So we have our spectral trace here. It was inverted by the setting, so I'm just going to take the invert off. And I'll also change the frequency because we're looking at a superficial structure. So we're just going to take the frequency up, and we can see things very clearly there. I'm also just going to decrease the PRF a little bit so we have a larger waveform to look at, and I'll take the baseline down just so that waveform is in the middle of our image. Now if I wanted to do some measurements on this, I can press freeze and then measure, and we can just choose an auto trace. Oh, we're not in the velocity menu. There it is, auto trace, and we can choose to trace either above, below, or both directions. So that's the posterior tibial artery. Now if you want to save that, all you have to do is press on the camera icon in the top left corner, and that'll save our picture and our measurements. I'll unfreeze the image now, and we'll go back to the full screen, and let's have a look for the anterior tibial artery. So we're going to come across and take colour off for a moment. Just come across to the front of the ankle, and this one's actually pretty easy to find. It's just sitting right there, almost in the midline, and I'll put the colour flow back on, and that setting looks quite nice. And we'll just go ahead and press pulse wave again, and I'll move my box so it's where the artery is, and we get our waveform there, and nothing to adjust on this one, so I can just go ahead and freeze. And if we want to, again, we can measure and just use our auto trace and save. Let's follow this artery down to the foot, so we're just going to rotate the transducer back 90 degrees just to make it a little bit easier to follow, and if we want to, we can just adjust that color box back into square. And I'm going to just slowly trace distally with the ultrasound transducer, and we're just going to take it down as far as we want to, and we're still going here. So that's probably as far as we can take it. So what we're going to do now is just take the transducer and just rotate it back 90 degrees so that we can get that artery in long axis. There it is. And we'll just move that box across so we can get that artery before it dives down there. So let's bring this up. See if we can steer this a little bit. And we're going to press the pulse wave, and we're going to bring the sampling box over here. We can just adjust our sample angle again. Take it back to 60, same as we did with the others. And there's our trace. Now we can make a little adjustment here to the PRF. We'll just decrease the PRF. So we get a nice waveform to look at. And I'm going to increase the gain a little bit as well. And there we have our waveform. So once again, if we want to, we can take a measurement of that. There we are. So we just freeze there, and we hit up here, and we go down to auto trace, and there's our measurement, and we save that one as well.